Thank you so much, everyone, for joining our webinar today, A Gender Lens Response to COVID-19 Funding and Philanthropy. My name is Natalie, and I am part of the AVPN team in Hong Kong. I am incredibly excited to be facilitating a dialogue between our two speakers, Bonnie and Nisha. Today, our topic is really looking at the fact that data has shown that women and girls across Asia and the globe are disproportionately affected by COVID-19. And these gendered impacts require an urgent response from funders and philanthropists. Today, both of our speakers will be sharing their insights from working at the intersection of gender, philanthropy, and investments, as well as programming which centers women and girls. So I am excited to introduce Bonnie Chu, who is the Managing Director of the Social Investment Consultancy, a global network of consultants specialized in impact measurement and social investment strategies. She is also founder of an award-winning social enterprise, which provides photography training to marginalized women and girls in 23 countries and provides platforms to sell their work. Bonnie brings to the conversation today her vast experience in building gender lens investing strategies and amplifying the voices of women and girls. Bonnie has authored an investor toolkit with a focus on girls and young women funded by DFID. She has set up a £15 million Women in Safe Homes Fund with Big Society Capital and co-founded the Diversity Forum for Inclusive Social Investment. Bonnie has also recently been appointed to join the board of LHA London, which owns 12 hostels across London for young people with a £230 million property portfolio and provides £500,000 in grants every year. I am also excited to introduce our speaker, Nisha Dhawan, Country Director, India at Empower, the Emerging Markets Foundation. Nisha is passionate about creating spaces to amplify the voices of girls, and she oversees Empower's work in a country of strategic importance and has been integral to many of Empower's programs for girls since she joined the foundation in 2012. Before assuming this role, she was the director of Adolescent Girls and Gender Initiatives, where she collaborated with Empower's global program team to consolidate innovation in programming that centered girls through capacity building using workshops, technical assistance, and the cross-pollination of learnings in all 15 countries that Empower works in. Before joining Empower, Nisha worked at Apt Associates Intelli as a gender and markets linkages specialist on a USAID-funded project, examining food, agriculture, and rural market systems. Nisha also brings a lens of finance to her work in gender. She began her career working in equities compliance at Deutsche Bank and Barclays in London, where she managed the bank's relationship with regulators and exchanges. Nisha is also a TEDx speaker, where she shared her passion about enabling girls' voices to be heard, which is also a key topic that we will discuss today. So Bonnie and Nisha, I am very excited to be facilitating this dialogue today. Thank you for being here. To begin with, I would like to share a framework that came up in our discussion together. As my colleague Gloria and I were speaking to Nisha and Bonnie about how to approach this conversation about a gender lens response to COVID-19 funding and philanthropy, we were very aligned on the idea that it should be looking at short-term, medium-term, and long-term, or in other words, a framework which looks at react, respond, and recover. When we think about the react phase, we are defining it as programs, funding, or any support that happened immediately, whether for emergency relief or to meet urgent needs. This was because people were, in a way, doing whatever they could in a situation that was unprecedented in our times. And slowly, these react streams come together to form a more coherent strategy where we call it respond. Which are currently a lot of the programs and funding strategies that we see today. And all of this will continue to lead on to the road to recovery. This is something, of course, that we can start planning for right now. thinking about important questions like how do we build back better? And how do we, in this recovery process, push for systems change that really lifts up the most vulnerable communities rather than leave them behind? Without further ado, I would love to dive right into the discussion. And to begin with, both of you, Bonnie and Nisha, you have worked both strategically at a high level, looking at funding and philanthropy in gender, and you have also worked at a very community level directly with your beneficiaries on the ground. And of course, when we are talking about all of this, today's webinar will be focused on the experiences of women and girls. But we would also like to take the time to acknowledge that when we look at a gender lens, we are looking really at all genders, their unique experiences, and how they each play a role in the current situation as well as the road to recovery. But today, the scope will be looking mainly at women and girls. And Nisha, I would love to hear from you. In your work, what are some concrete and unique challenges that you've seen faced by women and girls during COVID-19? Nisha, over to you.
Thank you so much, Natalie. It's lovely to be here. Before I begin, I want to frame my response through two frames. And the first is when we talk about what women and girls are facing in terms of the impact of COVID-19. It isn't the impact of COVID-19 is one thing, but it is also the exacerbation of inequalities and issues that have always existed. So I've heard a lot of people say, why are you focusing on girls? Because there's this huge issue with regards to COVID-19. And to that, I would like everyone to reflect upon the fact that women and girls are facing all of the issues that are being lifted up by the discourse around COVID-19. And in addition to these things, they're also facing unique challenges. The second frame I'd like to use is, as Natalie, you mentioned, the three stages, the short, medium, and long, or the react, respond, repair. Even the challenges need to be viewed in terms of the immediate short term and what is manifesting itself as long-term sustainable, like challenges that are systemic. So today, I'm going to actually lift up what was said in a webinar that we hosted on the same subject about women and girls and the gender response to COVID within the Indian context. And if you look at the screen in front of you, the girl in the black and white picture wearing a face mask is Seema, and she's 19 years old, and she's one of the program participants that we work with, and she was one of our panelists. So I am merely lifting up what she and her co-panelists said. So in the short term, the first response is aid, right? And this is what we're saying. But we also need to recognize that there's been a lack of access to emergency aid for the most marginalized. So those who are in power will control resources. And in some cases, and this is what we're seeing, is that the most marginalized will not even know that aid is being offered. The second thing is, globally we're hearing stay home, stay safe. And that is the biggest lie for several women and girls. The girls shared in the webinar that whenever there is violence at home, pre-COVID, they could leave the house. There was places where they could go. There was social capital around them. There was friends, there was peers, there were family. And now that's all disappeared. So now that they're locked in, they're either witnessing or they're on the receiving end of violence. And case in point is that Childline India registered over 90,000 calls in the first 11 days of the lockdown that was imposed, that is continuing in India. And that's a 90% increase. And that number does not even take into account the many, many young people, the many women and girls who are not calling out and reaching out for help. The other thing that I think we need to consider is that social distancing is not a possibility. In the city of Mumbai, in the slum communities, there are approximately 1,300 people for every toilet. So how will you socially distance if you need to use the loo? Additionally, water only comes to the community for a couple of hours a day, and girls are tasked with fetching water. So when water is so prized, washing hands is deprioritized in the face of cooking and drinking water. The other thing that we're noticing is, of course, that there's an exacerbation of the digital divide. So for the girls enrolled in school, many of the schools that they don't go to have not moved schooling online. And in the few cases where they have, technology is so fiercely protected by men and boys in the family that there isn't any access. And that too is in situations where they can't afford computers and tablets and all of the things that are required to move virtually. And I think we also need to consider at this point, just taking one step back, is the role that women are playing in the relation to the outbreak itself. With the majority of frontline workers, activists, and mobilizers are women. And essentially, for as long as we've known, women have always been the first responders of the community. Now, quickly moving on to the consequential long-term challenges that are manifesting in the communities where we work. The first is in relation to health. Existing illnesses are given a backseat. Reports from our community workers in Mumbai state that illness is being ignored. And we saw this during the Ebola pandemic. Existing and sometimes even life-threatening illnesses were ignored by women and girls in favor of the community. In the sphere of education, 89% of students enrolled in schooling are not in school currently. And that number doesn't even begin to consider the 130 million girls who have never been enrolled in school or have been pulled out of school. And this is very, very problematic for girls, because if schooling is truncated, it is very unlikely that girls will return to school. Especially in times of pandemics, in times of crisis, girls' education is deprioritized. When people are worried about their basic survival, they will not be considering girls' education. So the lack of school is going to now increase that 130 million number as opposed to reduce it. Now, when we move to the livelihoods, 95% of women in India are employed in the informal sector. There is no work from home option for a street vendor. A lot of women are from women-headed households, and in terms of livelihoods, we're seeing that employers are not paying their staff. We've seen a massive exodus of migrant workers returning home from urban areas without lack of access or even certainty around basic livelihoods. There was a journalist who was talking about this, the migration back home from urban to rural areas. And she asked a little girl, she said, what does coronavirus mean? And she said, it simply means that I have no food. And that's because she didn't have a father, and her mother was a daily wage earner. So, the consequence of this is that with the pressure to provide financially for families, girls are unlikely to have savings, and the most vulnerable can be forced to survive through transactional sex or survival sex. Ultimately, the challenges that are manifesting themselves is revealing that we are going backwards in relation to the progress that civil society has made, that governments have made, in that the private sector has made in relation to the progress for girls. And I think why it's very important to reflect deeply on these challenges is because how we react and how we respond will actually chart the trajectory for how we repair. Thank you. Bonnie?
Great, thanks so much, Nisha, for that. It's quite heavy, isn't it? For me, it's Friday morning. I'm calling in from the UK, and I think the scale of challenges is really unprecedented for all of humanity, but especially for women and girls. But perhaps I can offer a bit of a counter narrative and some of the hope I see, because women and girls have also been so used to turning challenges into opportunities and doing whatever they can with the very little they have. So these are some of the pictures I've got from the group that I founded that you mentioned, Natalie, Lensational. So we've been doing this series on COVID-19 and getting our participants from all across the world, but mainly in sub-Saharan Africa, to document their experiences during COVID-19. And I think these 4 pictures really help kind of us to really understand what are the gender roles in the pandemic, and therefore teasing out those unique challenges in a more human way, but also thinking through into the future, how can we really capture these momentum and energy to really build a gender equitable future. I know on the left you mentioned social distancing, Nisha. So these girls, you see, they didn't socially distance, but at least they're eager to wash their hands, which is also quite welcome. This is a photo I got from our students in Masai Mara in rural parts of Kenya. What I liked about this, I was told that they just set up kind of a hand washing station and really encourage everyone to constantly wash their hands. I mean, it seems like a very small thing, but it really shows the entrepreneurialism and how people are responding to it. But it also shows the challenge that Nisha mentioned, that social distancing is simply not possible in impoverished communities. And hopefully these are some of the pictures and realities that I think challenge some of the assumptions behind health messaging, and what we've learned as I guess intermediaries in trying to support these women and girls is understanding their constraints and just rallying that and amplifying their voices so that there might be other solutions we can come up with to accommodate their constraints. The second photo in the middle, also from this community in the Masai Mara, one of the women artisans, they used to make beadwork, but because of the economic disruption, they have changed to making masks, which is great because they've adapted really quickly, and they're still able, this social enterprise that we partner with, Rojo, they're still able to produce, to provide income for these women artisans. And one of the women, she managed, well, she gave birth to a little child, and you know, life goes on during COVID-19, but the question is, what are the health services during these times for pregnant women and for mothers? And this is where a lot of civil society organizations are filling those gaps, because a lot of government agencies don't have those gender lens in the way they deliver their services. And because guess what, you know, most of the politicians and people in charge are not women. So I think this is where the unique role of really philanthropy and those that philanthropists support is to fill those gaps and to ensure that these mothers are still having a very productive birth, and their child, their children are off to a really good start in life, because otherwise we'll see a huge challenge a few years down the road, and we already know the importance of early years development. And then over to the bottom right on your screen is healthcare workers, the role of women at work and as frontline workers, and that their roles just really need to be celebrated. This is taken in Accra in Ghana. This was actually pre-COVID, but we want to resurface this during COVID. This is a female pharmacist. We asked our students to do a series of women at work, because women are not just at home, and a lot of the stories have been, you know, women and their care responsibilities, but actually they have been a very productive part of our economy. And what we see is, you know, they are playing a really important role in the health care industry, but also in the UK, like what I've seen is actually women were about 1/3 more likely than men to be working in a sector that has been shut down. So there's this livelihoods part that Nisha already touched upon, but I think that need to be addressed and serviced more in the way we respond in the future. I want to kind of end this narrative on the top right, and that's the role of girls. So this is taken by our students, MISPA, also in Accra, Ghana, of 2 girls, and how they're, you know, performing the good practice of washing your hands and how you can help your friend to do that. I mean, girls, they are facing such tremendous challenges. What really pains me is the importance of access to education that so many people have fought for, but how it's been disrupted during this crisis, but for many that there might not be a chance anymore to go back. And we already see instances of child marriage going up. There's no good data on that because of the taboo and the challenges that with gathering data, digital divide, etc. But I think girls really need to be at the center of the conversation. And how can we, as in the philanthropic community, see them not only as passive beneficiaries, but really active agents of change? I mean, there's so many stories of them just coming up with things. I've interviewed as part of writing on Forbes on gender justice funders. I remember one funder telling me that she's never seen such high levels of like feminist mobilization, and she feels actually the feminist movement is going through a resurgence because with crisis, women and girls are actually finding their agency just to try and do something within their own constraints. One story that really touched me that my client UNICEF India told me is that they have a program, an aftercare program supporting young people leaving institutional care across India, and in Odisha, which currently is hit by the cyclone. They have two girls as part of that program, 19 years old, just left institutional care, volunteering to work at the call center every day, calling 200 people or so to track who have been quarantined and to make sure that they are not, well, to basically contact trace those people who have been quarantined. And I just think there's so much energy actually that philanthropists should really help capture and elevate and amplify their leadership, and seeing this, you know, understanding the risk, but really embracing the opportunities from a gender lens.
Thank you, Bonnie, and thank you, Nisha. Certainly some very heavy, as you said, and challenging realities that are occurring, but also there are stories of hope, which is making me very optimistic. So in that vein, given these realities for women and girls around the world, what are some concrete ways that funders and philanthropists can address these unique challenges? And maybe Bonnie, you can start.
Great. Thanks. So yeah, I think there are lots that philanthropists can do. And I think one thing is really to start with the data and to understand what's already being done. And we at the consultancy just kind of did a rapid review of existing data sets that talk about the impact of COVID-19 on vulnerable groups. And actually there's quite a lot on gender. We've created an interactive database. So this is more just the high level summary of the data sets that's included in our database. And you can see 16 of the 27 data sets we've looked at, so over half, actually cover the impact of COVID-19 on gender. So I think if you're interested, you know, look at that database, look at the evidence base that's currently being really clear what kind of effect COVID-19 really has on from a gender perspective, and then align that with your own philanthropy, your own kind of strengths and assets that you can bring to the table. But I want to share some of the things I've heard from funders. I've interviewed, I think, over 15 funders in the past 6 weeks, mainly funders that have a gender lens in the way they work, including Empower. I've interviewed them as part of doing this series on Forbes. So I think a few things that come to my mind. One is being unapologetic about a gender lens, even if you haven't previously focused on it or have previously felt you didn't want to be that explicit about kind of having a gender focus. I mean, the evidence base is really clear that women and girls, while they are not dying and contracting the virus as much as men and boys, but that's only a very small part of actually the impact of COVID-19. They're suffering in so many other domains that we really need a gender lens to understand what's the impact and to redress those inequalities. So I would really encourage funders, if you don't have that gender lens before, to consider it even just for your COVID response. And I've already seen a few funders in the UK learning and adapting that, even if it's just focused on gender-based violence to start with, and addressing that issue. There are a few things as well that are more around how philanthropists give, and I've learned a lot from gender justice funders how the trust-based relationships they really have with their grantees. One person I interviewed from the Collective Future Fund in the US, she told me that rapid response is actually not new to them, because they've always recognized that if you support groups, grassroots organizations and groups led by women of color, trans communities that have so many challenges in their personal lives, that they're always competing priorities. So they always have to have an extra set of money to help them wherever their organizations need. And that was quite profound for me, because right now we see the need for rapid response, but actually it's always been there if you're really supporting the most vulnerable groups. So I would encourage funders to really think about what's your role in, how can you be more rapid in your giving and really deploying your funds, and also being flexible in the way you give. What I would end on before maybe hearing more from Nisha is while you give in the short term, also consider the long-term systemic impact that it will have, and they need to go hand in hand. One quote I want to share from, again, the interviews I have is that the frame for this virus should not just be that we're at war with this virus, but actually how can we shift the culture and create a culture of care that will all help us heal from this pandemic. But the healing from this pandemic is also healing from the systemic inequalities that have just been laid bare by this crisis, but have always been there. And I think philanthropy really plays that critical role to show those best practices that then others can follow. Anisha, yeah, we'd love to hear your thoughts on that.
Absolutely, thank you so much. And I just want to lift up one of the things that you said, which is that we need, when we think about react, respond, repair, we cannot isolate react and respond from one another. And similarly, we cannot isolate our response in the sort of immediate term from our eventual repair. I think all of those need to go hand in hand. I want to address the first part of this question, which is the concrete steps that we have taken to address the challenges that we've been speaking about until now, by really charting the journey, two journeys, as you can see on your screen right now. The first is the journey of our partners, our local partners who we work with on the ground. So while we work in 15 different countries, I am going to, by and large, share examples from this region. So India, China, Philippines, Hong Kong, Indonesia, China, and Vietnam. The top line answer to this question is, in terms of what funders and philanthropists can do, the single most important thing is to enact trust. And what I mean by that is listen to what young people are telling you, listen to what girls are telling you, and listen deeply and trust local partners, because they're at the front lines. They're seeing the reality on the ground on a daily basis. So now I'd like to move in to really go through the two arrows on your screen. The first one is the immediate reaction and response of our grantee partners, and the second arrow below is what are we doing as Empower, as a foundation, in terms of our reaction and our response. So I'm going to share both of those journeys with you. So when we look at immediate reaction, I think the first thing is, of course, emergency food and supplies. So our Vietnamese grantee partner, Blue Dragon Children's Foundation, helped deliver food staples and other essentials to family in need. But beyond that, they launched an emergency appeal to get children off the streets and to provide critical support to families who had lost incomes from COVID-19. So it was far greater than just distributing resources. What we're seeing in India is that emergency response is, our partners have assumed a very strong gender lens. So our partners, Chintan, Azad Foundation, and Saath, amongst others, are including sanitary napkins in their emergency response kits, including diapers, all as part of their emergency relief. The other thing that we're seeing is that There are ways to make emergency provisions a tool for agency. So our grantee partner, Akshara, is actually employing cash transfers directly to girls so that if resources stay within the hands of girls, it provides them with the agency to really procure what they need. And then now moving on to PPE equipment. Very similar to emergency relief, it is very important to provide an ecosystem of education and awareness around PPE equipment, because there's a lot of misinformation, WhatsApp messages, around what constitutes the spread of COVID, how and when PPE equipment should be used. So in Indonesia, our grantee partner YKB have been trained in the practice of clean and healthy life. They've employed ideas of social distancing, the importance of wearing a mask. They've really ramped up their social media efforts to ensure that young people are actually receiving vital information, not only about COVID, but also in relation to their sexual and reproductive health. And peer educators are at the front line. These are young people at the front line who have been mobilized to prevent the spread of COVID within their own villages. And now moving on to immediate psychological response. I mean, this is something that's really coming out in our discussion thus far, is there is a social and mental toll being taken out on young people, on girls, on women. And in Colombia, our partner Tiempo de Juego is actually, addressing that as part of their immediate reaction. So they're offering psychological support on Facebook every day for like a full 8-hour day. They're using social media as a tool to talk about myths and truths around COVID, emotional health, how to access support services in the case of domestic violence. Our grantee partner Azad Foundation, one of their first reactions was to reach out to the girls who are experiencing gender-based violence as a result of the lockdown. So, the next thing is, of course, mobilizing young people. We've seen this in the examples I've given you thus far. Our grantee partner, Vacha, again, all of their immediate emergency response, girls were at the front lines. Their agility, their know-how, their aptitude, their self-confidence really shone through because they were at the front lines. The other thing is that having girls do this is they provide frequent check-ins, vis-a-vis the emergency response. They're actually also providing check-ins to people to the other girls within their community to say, is everything okay? Do you need us? Can we lean in? The last thing I want to mention is data. And I think the wisdom of our local partners in relation to immediate response has been mind-blowing. One of our grantee partners, Jan Sahas, within 5 days of India going into lockdown, reached out to over 3,000 migrant workers to learn what the situation was on the ground. And they actually created a report to provide recommendations, not only to foundations and corporates, but also to the government in relation to what is happening on the ground in terms of migrant workers. I'd like to now move over to our grantee partner response. So this is, in many ways, this is kind of where we are right now, right? We've had several months of the lockdown being in place in the countries that we're working in. And now we're really sort of seeing our grantee partners think strategically, think into the medium term. So our grantee partner, Kelly in Hong Kong, they're teaching young people coding online, but along with the work that they're doing in relation to coding and the technical work, they've also implemented a core youth development module. So both of these things are happening side by side and really illustrating the importance of building resilience in girls at this time. Additionally, You know, we're seeing with Kelly that they're also taking the next steps. You can't stop at just taking training online. You have to also address the digital divide. So Kelly is providing the means of access through phone top-ups, through smartphones, through tablets, to the young people that they work with, so that they're not missing out as a consequence of the ecosystem that they live within. You know, we're also seeing our partners not only address the immediate, you know, issues, but also addressing the issues that emerged as a result of COVID-19. So Akshara, our grantee partner in India, launched a huge domestic violence campaign. They've reached out to almost 5 million people and really lifted up the reality of gender-based violence as a consequence of COVID-19. So, and through this mechanism, they've actually engaged in coordinated efforts within the community to enable people to speak out and seek recourse in relation to this issue. And then the last thing is that we're seeing people really lift up the importance of addressing mental health. Mental health is coming to the forefront as so many of our partners recognize the need to include this in a COVID response, in a holistic COVID response. Our grantee partner, Kriya, is doing this through creating a hotline so people can phone in and really engage with practitioners, with experts on the issues that they're facing. I'll now move on to Empower's reactions in terms of, you know, we're sharing our journey up until now. So if we look at the reaction phase, very, very early on in March, Kristen Wolf, who's our Vice President of Programs, reached out to all of our grantee partners to say, and I quote, "Let me reassure you that you are not alone. More than ever, Empower stands beside you. We believe in the strength and resiliency of our partners and the courageous young people in your community." So what does that mean in concrete terms? We made 3 very, very strong promises. The first is that as an organization, we will honor our financial commitments to our grantee partners. The second is that we will provide flexible support so that grantee partners could reprogram up to 50% of their grants to unrestricted funding, what they needed to pay staff salaries, to keep the lights on, to engage in an immediate response. And that we will continue to be there for our partners. It was a strong expression of solidarity. And we did that by, in the very, very early days, our program team actually got on the phone and reached out to every single one of our 100+ grantee partners in 15 different countries. Now moving to the response, you know, I think we're seeing a high level of thought partnership and trust. So trust on our part to really trust what our grantee partners are seeing on the ground, and really working closely with them to build effective programming to address this unprecedented crisis. We've done that through emergency grants. So in addition to the flexible funding that I described earlier, our program team has made 11 emergency grants to partners to respond effectively to this crisis. The second thing is that we are lifting up the voices of girls. So we've seen our partners do this. Our grantee partner, YP Foundation, actually spoke to girls in 25 states so that their response could be in line with what girls need. We're sharing that out with our other partners, right? So we become a space to really, if one of our grantee partners has an innovation, to share that out with other grantee partners. Additionally, I'd mentioned the webinar and the results, the outcomes I shared with you at the top of this call. But we really asked the girls, like, what is the reality you are seeing? And what do you want practitioners to know about what's happening on that ground? So we really see our role as handing over the microphones to girls so that their voices can be amplified front and center. And then the last thing I would say is we see an important role for ourselves in creating virtual spaces for exchange. One thing that we had a exchange for very young adolescent girls planned in Peru for several of our partners in Latin America. And obviously that couldn't happen in the way that it was initially envisioned. And our program officers have moved that entirely online. So there is a site for connection, for collaboration, for thought partnering. In India, we have again engaged several of our grantee partners. One of the things that we're doing, our partner Antarang Foundation is coordinating an 8-part organizational development for frontline workers on mental health and addressing the real impacts of COVID. All right, so I will stop there and hand it back over to you, Natalie.
Thank you, Nisha, and thank you, Bonnie, for those very tangible takeaways. It's certainly, not only inspiring, but also powerful in the way that our participants today can take action to immediately implement some of these concrete steps. So looking ahead to a post-COVID world, how can funders collaborate with grantees to address these gendered impacts in the recovery process, especially thinking about, as you both mentioned, Nisha and Bonnie, the power of making sure these approaches are community-led and girl-centered? And Nisha, maybe you can start.
Absolutely. I'm really looking at answering this question in relation to repair. And when we think about repair, I think one of the things that we need to recognize and essentially remove from our vocabularies, because everyone's doing it, I'm doing it, right? Where we say, when things go back to normal, because we are not going back to normal. The world has forever changed. The lives of those impacted has forever changed. And there are long-term effects to the reality of COVID. These are irreversible systemic changes. And I think that needs to become our point of departure. So in many ways, everything that we've known until now is not going to hold up in a post-COVID world. So I want to actually show 2 pictures to illustrate what I mean. So the first picture on the left is our partner Roots of Health in the Philippines, and the second picture on the right is our Girls Advisory Council, which is basically our advisory council in India that has created and charted our grant-making strategy for India. What you see in these pictures is not going to happen for a very, very long time. So how do we sustain change? How do we repair what's been broken while recognizing that there's been this seismic systemic shift? And I think we need to do that sort of through a 2-pronged approach. One is in our practices, and what I mean by that is practices as foundations. And then the second is in relation to programming, like the actual pedagogy, the actual methodology around programming, because both necessitate a shift at this particular point in time. So beginning with practices first, I think the first and most important thing is to listen to girls in a meaningful and non-tokenistic manner. Put girls at the center of decision-making, listen to the issues that they're facing and any innovation and ideas that they have. I think it's really about amplifying and recognizing the wisdom of girls. The second, of course, is to increase flexibility. Flexibility in terms of funding, flexibility in terms of timelines and reporting deadlines. It is to move to a culture of flexibility from a culture of rigidity. Of course, the next is to enact trust. Recognize the wisdom of people who are working on the ground and what they've managed to do both in terms of reaction and response. Because that is a true testament to their agility, to their thoughtfulness, and their connection to the communities that they serve. We need to also consider COVID beyond the medical and the economic. This has to be opened up. We need to shed light on all of the other underlying systemic inequalities that COVID has brought to the forefront. Again, I've mentioned it before, so very quickly, when we talk about repair, we need to address bridging the digital divide. How do we leverage media? How do we leverage online resources so it can reach as many people as possible? I think in terms of our practice, the most important thing to remember is how do we consider intersectionality and the multiple levels of marginalization because of gender, because of sexual orientation, race, class, the whole gamut of the intersectionalities that exist in the lives of the people that we work with. And then moving into programming, I think programming needs to be addressed with equal parts. The recipe is equal parts compassion and strategy. So, you know, the actual nuts and bolts of programs offered by civil society, you know, need to contain these two components. So when we think about livelihoods, we need to recognize that economic crises affect the least stable jobs, and those are the ones that belong to women. It's always going to be the last in, first out. So women are the last to be hired and the first to be fired. And we need to account that, you know, there is a burden of unpaid care work. And a lot of this is coming from the male breadwinner ideology, right? If men are the primary providers, they're likely going to be the ones who are hired back first. And when markets shrink, which they will, which we are seeing, the last people to be hired will be girls and women. I think we also need to consider the issue of migrant workers. If people have left, what are they going back to in terms of livelihood opportunities, but also what are the opportunities that remain? I mean, is there recourse for them to come back? You know, and this is really, really important. Like if you consider that 9% of the Philippines GDP comes from remittances, what is that doing if people are not coming back? And if there's no movement. When we think about education, we've mentioned the 89% of people who are not in school. I think retention, re-enrollment and retention of girls is front and center in terms of long-term repair. Because when there's a break and the longer the break is, girls are less likely to attend school. And that's inevitably going to lead to an increase in early marriage. We also need to focus on 21st century life skills so that girls can compete for future jobs. You know, when we think about health and well-being, we need to think about violence. You know, Ebola was called the rape pandemic, and it's happening again. As we repair, we must dig deep to address the impact of stay home, stay safe. And, you know, perhaps there's opportunity here, and it might be a watershed moment for gender-based violence and addressing it. You know, what we've seen in the sexual reproductive health rights space is that there is a renewed confirmation that SRHR needs to be more than just service delivery. It has to be about awareness and assertion of rights. And of course, we cannot leave boys and men out of the discourse. We're seeing this in locations where we are working with men and boys. The results of communities where there is such programming are very much coming through as a holistic response to the crisis. And that's something that needs to sustain as we move into the repair space. So solemnly, we need to recognize that we are going backwards, but at the same time, we need to recognize that there is opportunity for a systemic shift here. And anyone who's working in the gender justice space has a very, very important job, which is to speak loudly about the importance of considering gender in a COVID response. And the last thing is, I think collaboration doesn't end between funders and grantees. It's one site for collaboration. We need to break down silos of work, stop looking at things as gender or livelihoods, but look at livelihoods from a gendered perspective. Look at COVID response from a gendered perspective. And it's only when we look at the ecosystem of development will we ever recover in a meaningful manner. Thanks. Over to you, Bonnie.
Thanks. Yeah, you've been so comprehensive in your response, and we don't have that much time left, so I want to make sure there's a bit of space to Q&A. So I'll just run through very quickly. We created a funding decision metrics that you can find on our website, and this is more to help funders to think through COVID-19 responses, how you make decisions, because there's so many things out there, can be quite overwhelming. So the 2 layers is really looking outwards, so looking contextually what you can be doing, and then looking inwards, organizationally, what are your constraints and how best you can make a difference within those constraints. So looking outwardly, look, it's really thinking through what are your roles as philanthropists and where you can make the biggest difference. And I think what is really lacking beyond just giving grants is really resourcing infrastructure, data, communications, coordination, particularly coordinating, allowing your grantees to coordinate with each other, and giving that space for them and providing them with plugging them with other networks that could really support them, and emotional support to your grantees. And of course, trust and power dynamics are always an issue, but where we've seen work really well is funders providing that emotional support to their grantees while they're facing such difficult challenges. The other thing around framing is there are different frames, you know, for philanthropists to be making a difference in COVID-19 response. And with a gender lens, what the kind of framing we really need to have is one of equity. Back to what Nisha was saying, is one of intersectionality. Gender is one aspect of how some groups are affected more disproportionately than others, but it should really move us towards justice and equity. So really pushing that framing in your philanthropy would be really critical. And then in terms of delivery, what I also feel is lacking in philanthropy is that we tend to fund organizations, but what has emerged out of COVID-19 is that you have so many informal organizations like self-help groups, mutual aid groups, unions, movements, doing so much in COVID-19, and could philanthropy actually rise to the challenge to fund those more informal groups? And then I think organizationally, I mean, there's lots of challenges I'm sure all of you have, but operationally, could this really be a time for philanthropists and foundations to challenge themselves? If you can be more agile, if you could be more participatory and trusting your grantees and other partners. So hopefully this is just a interesting or a way of like structuring your thinking around this, because it could be quite overwhelming. And I just want to respond also to some of the comments that have come up. One of the ways we can collaborate with each other in this AVPN community and broader is to be tracking and collecting data around where the philanthropic dollar is really going. And there's been quite a lot of different attempts, but those attempts have always been just a snapshot in time, like the donor tracker, they had a gender specific one. And now I've just pasted in the chat box an organization, DevX and Tableau, a data visualization software, just launched yesterday a COVID funding tracker, and there's one you can highlight women and girls. So I was quite pleasantly surprised as there's a women and girls kind of tab there that you can look into. So I think, but we need to be capturing the data. We need to be understanding where the philanthropic dollar is going and hold ourselves to account so that we can really be redressing the gender inequalities that we have seen surface from this crisis. And I know Gloria now will be moderating the Q&A.
Yes, thank you so much, Bonnie and Nisha. And Gloria, over to you.
Thank you, ladies and gentlemen, for joining us. This has been a very, very heavy topics for the day, well, Friday afternoon, but I thought that it was necessary to introduce the gender lens investment during the COVID-19 crisis. I have picked up a few questions. I think Bonnie has swiftly answered a very rapid response. Thank you so much, Bonnie. But I do pick up a few lines I want to discuss with the speakers here. From Nisha, I think a mental health issue you mentioned, and I keep hearing Livelihood over and over from many, many, many organizations for the last several months. And I want to ask Bonnie first about the funders actually already has a gender lens investing angles, how rapidly they are actually responding compared to the ones that don't. And how can we really shift the culture and heal post-pandemic? Can you answer me within a minute? Thank you so much.
And so I've seen gender justice funders respond in 1 to 3 weeks. So 1 week more supporting the existing grantees, and within 3 weeks setting up new funds that could attract new groups. For the wider non-gender justice funders, I mean, the problem is we're not sharing the data, and I think people are a bit scared of like being seen as compared to others. But I'm in a few data subgroups for the philanthropic sector. I just think they respond a bit slower. Because they don't have the infrastructure, they don't have those processes to be dispersing grants very quickly, and they don't have those trust-based mechanisms that you see gender justice funders have. So they are just catching up, but hopefully they will learn from the gender justice funders. I mean, also like Empower has done a phenomenal job, and hopefully those broader funders will actually learn from this and be more flexible and quicker in what they do after the crisis as well.
Thank you, Bonnie, so much for the answer. I'm turning into Nisha. I picked up the mental health livelihood you mentioned over and over, and I also have heard from many, many people in the past. You said, how do we repair what's been broken? I want to go back to Bonnie's chart when she mentioned governance. Do you think governance actually is the key for any companies and funders, even without gender lens investing, to have a segment in their funding sort of investment portfolio to sort of could implement better in crisis like this in a global pandemic? Thank you.
The one word answer is yes. I think that the things that we talked about, the issues that we talked about span across the board, right? It doesn't matter who you are. When you're looking at engagement in the workforce, when you're looking at building resiliency, two separate things here. You absolutely 100% have to consider it. You have to consider the gendered response. You have to consider a holistic response to whatever you're getting. I mean, if we look at vocational training programs, like if we go back 20 years and look at vocational training programs or livelihood programs that just taught a technical skill and then it was done. The long-term effects in terms of retention, especially when it came to the female labor force, weren't that great. And that is agnostic of sector. We're not talking just about cottage industries or just about women in corporates. So on the livelihoods front, absolutely must be considered. And I think on the mental health front, I think this is a newer public recognition. I think there is a new lifting up of the importance of mental health. And what exactly do we mean by that? I think we have to break that down. I think it's about building resilience. It's about building social capital, about, creating those networks. It's about building self-confidence so that, young people, girls, are not recipients of a service, but rather that they have the agency to be able to chart their own life trajectory. And I think that's the difference, right? If you're engaging in the person, if you are engaging in their long-term transformation, recognizing the importance of building resilience, recognizing the importance of sustaining their mental health, that's when you're going to be successful.
Thank you so much, Nisha. And I want to give Bonnie the last word. See what you have to respond to what Nisha just said. I think it's very important we have a discussion. Thank you.
Yes, so the question is, does this open new opportunities for governance processes? I think we have seen anecdotally, this is not a scientific experiment, but anecdotally that female leaders have actually done better in political positions than male leaders. And it might just be some feminine qualities such as empathy and being more cautious and preparing and all that. I mean, I've seen in India, in Kerala, the health minister doing such a phenomenal job against all odds. And so, and me being in the UK and seeing the crazy drama that's unfolding, that's all run by men, right? So I think it opens up some questions around governance and leadership, and it gives people an opportunity to do things differently. And hopefully out of this, that we will actually have some concrete data to show the effectiveness of a diverse group making decisions versus a non-diverse group making decisions. And maybe that will be the prompt for really changing how we make decisions in philanthropy. But yeah, so I'm still hopeful. I think we definitely have a lot of things that have come up, especially from gender justice funders, how they have just been performing so phenomenally to navigate through this crisis.
Thank you, Bonnie. Thank you, Nisha, so much for joining us. And thank you for all the attendees. Today's topic is about gender lens. Also, in our conference a week from Monday on June 9th, the whole day is going to be gender lens investing. I know you ladies already signed up. For those of you who still have not signed up, please send me and Natalie now in message. We're trying to get you some view-only tickets. And this session is recorded. If you need a video copy because you have to leave early, you couldn't dial in, please let us know. Thank you again so much for joining us in Hong Kong for the Gender Lens Investing webinar for COVID-19 philanthropy. Thank you. Thank you, ladies. We'll see you guys very soon in our conference. Bye.